Hi everyone. I'm so happy to be live here with you. This is Dr. Vanshika Gupta Adukia. I am a pregnancy, child and lactation specialist, a prenatal postnatal fitness expert, and a pelvic floor physiotherapist. I'm also the founder of Therhappy, which is based out of Mumbai. Today I'm here to talk to you about a topic which we don't really land up discussing very often, and it's not a topic that everybody talks about very openly. It's regarding pregnancy. And the topic for today is body image related issues that you face during pregnancy. Now, I deal with a lot of pregnant moms, and very often during the course of interaction, they will tell me at some point that, doctor, I feel like there's a lot with regards to my body that I'm not feeling confident about. Or they would tell me that, doctor, I feel like what I used to be prior to conception, and gradually the way my body is showing me differences with time as something which I'm not being able to very easily accept. So, this is exactly why I'm here today to talk to you about the various aspects that women go through mentally, physically, emotionally during their pregnancy, and how their bodies are something which we need to talk about very openly during the journey of pregnancy and also be very confident about. So I think the first and foremost aspect which most women are very worried about during pregnancy is their weight gain. How much weight should you gain in pregnancy? How should you be going all about looking after that weight gain? When you have been conscious about your weight throughout, and gradually it's bound to happen that in pregnancy, slowly your weight will start going up. It starts getting a lot of people very conscious. They start feeling that currently it's okay that I'm gaining weight, but what will happen postpartum? How will I manage to shed this weight postpartum? And I think what I want to tell you today on the platform of Baby Chakra is that please keep in mind that weight gain during pregnancy is a healthy sign. It's absolutely okay if you're gaining weight at this point of time in your pregnancy because your body is trying to prepare itself for the journey of pregnancy and also for your journey of labor and delivery. When you're going to be giving birth, it is your body which is going to be going through so many changes and so many physical and anatomical processes that it is your body's way of sustaining through birth. You have to remember that your fat stores also increase in your breast to be able to help you lactate in your motherhood journey of breastfeeding. So these are all very natural and normal symptoms that you go through in pregnancy with regards to weight. And it's not something that should get you very anxious or worked up. I agree if the weight gain is keeping beyond a certain limit. Normally, if your BMI is of the regular range, let's say between uh, 18.5 to 24.5, you should be looking at gaining anywhere between 10 to 12 kgs in your pregnancy. That is a healthy weight gain for your pregnancy. But if you're somebody who's underweight or your BMI is on the lower side, you could look at gaining slightly even more weight, ranging between 12 to 15 kgs. And for those who lie beyond the BMI of 24.5, for them, we try to target to maintain your weight below 10 kilos because that is what is going to be healthy for you even during your pregnancy health. Okay, so this is a little bit about weight gain, but I know no matter what we say in terms of what the scale shows you, it still, tends to get to our minds and, we tend to get very frazzled about it. So, what can we do when we're trying to look after ourselves in pregnancy and also trying to take care of the weight gain? The first thing that you should focus on, make sure you're very active in your pregnancy. So you should be walking, you should conduct all your regular chores yourself, whatever you can manage, your home related chores, your cooking. We're all in COVID, everybody's in lockdown. So even your home chores like sweeping, mopping, doing your own basic necessities on a day to day basis will help you in staying active. If you can achieve that and you think that you still have time in hand, I would recommend everybody should exercise. So if you can get in touch with somebody to help you with pregnancy related fitness, that's very, very great. Not only to maintain your weight during pregnancy, but also to be able to help you with your natural vaginal birth, to help you with your cardiorespiratory system, to help you with your breathing. We all know that in pregnancy you feel little breathless. So if your circulation is going to be on point, and if your breathing is going to be taken care of, you will feel a lot better. It will help you with all your hormones. It will help you with your fatigue. So exercise can prove to be very, very beneficial. If nothing else, look at getting couple of minutes of a walk into your regular regime. So 5 to 6 times a week, you should be walking for at least 40 to 45 minutes in a day. These little steps can help you go a long way to look after your weight during pregnancy. Now, when I talk about weight gain, another very sensitive topic related to our bodies, if there is weight gain, is also women in pregnancy who don't gain too much weight. I get people who also ask me, doctor, my mother in law told me, or my sister told me, or this friend told me, or my family member told me that I have not gained too much weight. Why am I not gaining weight? They're saying it's not healthy for me. They're saying it's not healthy for my baby. What I want to tell you today is that if you're not gaining too much weight, provided you're eating healthy, you're not skipping your meals, you're staying active, and your baby is gaining weight. How do you know your baby is gaining weight? When you go to do your sonographies, on the sonography, you get an estimated weight. So there is a certain weight which is given to you in grams, and then there is a plus or a minus and a certain grams that's given. So you have to add and subtract. Suppose on my sonography report, it says that the baby is, let's say, 1,000 grams. There will be 1,000, and in brackets, there'll be plus or minus 150 grams. So you will add 150 grams and subtract 150 grams, and the range that your baby is in would be about 950 to 1,050. Okay, so this is how you would check what the range of the baby's weight is. So as long as the baby's weight is increasing, you're eating healthy, your activity levels are in check, you're feeling fit, you don't feel fatigued all the time, you don't feel like you need to put up your feet and rest all the time, your day-to-day chores are not impacted in any way, it's okay if you're not gaining weight the way people assume you should be gaining weight. So that's another aspect that I would want all of you to absolutely, if you're somebody who is having people on your head telling you gain weight, gain weight, gain weight, it's okay as long as the baby is keeping okay. So this is one second aspect that I wanted to share with you. Another thing which a lot of women tell me is that we all know that our skin color, especially in a country like ours, is something which very often people very easily get intimidated by. And in pregnancy, there are certain hormones that are released in our body because of which we can have a lot of pigmentation. So, some of the very natural signs of pigmentation on our body could be, earliest signs of pregnancy, or as pregnancy is progressing, we notice on our areola, the area which is there around the nipple on the breast, that starts becoming darker. Women start seeing a pigmented line around their belly button, over and below their belly button. But sometimes this pigmentation could also come on our face, it could come on our neck. For some people, it could come on their hands, and this starts getting them very conscious. They start wondering as to what is happening and why this kind of skin related color changes are happening, why these pigmentations are happening. Well, again, this is because of hormonal changes in your body, and you need to understand that this is something which will totally go away post pregnancy. So you don't have to look at having certain foods to try and get rid of it. This doesn't mean that if you're having pigmentation, so your baby's color is also going to be on the darker side or it's going to be on the lighter side. It has nothing to do with your baby's color. And don't worry that this is going to be a permanent change on your skin, because once the hormonal levels come down, this is also something which will be taken care of. So this was something a little bit about color, because I've had people who have asked me, the doctor, pigmentation around my neck or my face, people start having darkening around their mouth also. And that gets them worried, because otherwise under normal circumstances, you may have never had it before. And suddenly in pregnancy, you feel that pigmentation is becoming a problem or your skin is looking darker. Don't worry, it's going to get okay. Fourth point that I want to talk about today. Everybody says that in pregnancy, your hair is supposed to be shinier, it's supposed to get thicker, it's supposed to look nicer. And most women go through that in pregnancy and they're very happy with their hair in pregnancy. But with some women in pregnancy, they do tend to have hair fall. And these women sometimes get very, very anxious because everywhere we read that our hair is going to get better, and suddenly, when for you that is not happening, that seems like a reason of concern. Well, let me tell you again, we are going to be putting it back to the fact that it is hormonal in your body. It is something that your body is going through. But the other thing that could also be a reason for this is that sometimes we have to keep in mind that our hair goes through two phases. One is the growth phase, and the other is the shedding phase. It is possible that coincidentally, it's not the hormonal levels that have impacted your hair to become richer and thicker and shinier, but it is the growth phase, it is the shedding phase that your hair is in, because of which, instead of your hair growing faster, you are actually losing out on that hair. So it's not something you should be very anxious about. It will subside, it will go away, and it's not like it's going to leave you bald. So focus on a good nutritious diet. Make sure you keep your hair well moistured. If your ends are keeping dry, look at making sure that you use a serum. Look at making sure that you are having probably a biotin supplement. Biotin is very important for your hair. A rich protein diet is very important for your hair. So focus on these things. Oil your hair, whichever oil you're comfortable with, because every hair type takes better to a different form of oil. So whether it is olive oil or almond oil, whichever one works for you, basic coconut oil, make sure that you also look into your hair care regime and don't worry if you are comparatively having hair fall rather than having your hair growing better during pregnancy. This is also something which happens very commonly. Now, another very important topic that people used to bring to me during the COVID time used to be that, doctor, I was somebody who was very, very fit prior to conception. But because of COVID, I've not been able to go for my walks. I'm not being able to do any kind of a workout regime. And it's getting me very conscious about my body in terms of my energy levels. What if I reach a point where I'm not going to be able to go back to my pre-pregnancy state? What if a specific part of my body, more often than not women talk about their tummies because there are a lot of myths surrounding tummy fat and pregnancy. So they say, what if my tummy doesn't go back to what the pre-pregnancy tummy was like? Well, at this point of time, we must all understand that pregnancy doesn't necessarily mean that your stomach is always going to be hanging or your stomach will not be able to go back to what it used to be prior to conception. The concept that I would like to talk to you about today is diastasis recti. Now, what is diastasis recti? Diastasis recti is basically separation or widening of our stomach muscles, which cause us the stomach of a new mother to look like it is hanging. It takes a couple of weeks for your uterus to start involuting, which means that to for it to reverse back into its pre-pregnancy state, which is why it still looks bloated. For some women, it looks like the baby is still in there, but the baby is actually out. However, if you have diastasis recti, for such women, what you will see is that post their delivery, maybe 6 months, a year down the line, when they start working out or they start working on losing the pregnancy weight, they lose the weight from all parts of their bodies except from their tummy. And most people don't know this, but more often than not, this is because of the presence of diastasis recti. So this is the weakening of the stomach muscles, because of which the muscle has separated like this to make it wider, and therefore you feel like there is a bulge in the stomach. So you must work in pregnancy to strengthen your core muscles. I'm not saying you need to do crunches for that, because again, crunches are something which have to be avoided in pregnancy. But there are several ways that you can work on increasing your abdominal strength. And post delivery, you must make sure that you get yourself checked for diastasis recti, either with a postpartum specialist or by asking your gynecologist to do the same. And if you have diastasis recti, then you must work on reversing that diastasis recti with a specialist, and it is possible. The earlier you start, the better it will be. So don't worry, the next time you think about your pregnancy or you think about postpartum and how your tummy is going to be postpartum, remember, it's not necessary for you to have a hanging tummy postpartum. Even if you've had a C-section, a lot of people tell me, doctor, is that possible that after a C-section my stomach will go back in? It can definitely go back in, but these are cases of more often than not diastasis recti, and they must be looked after carefully. So now I'm going to move into some of the questions that have come for today for the live. So Lakshmi is asking me, how much weight does a pregnant woman gain? Lakshmi, my answer for you is actually there in the first part of the video, but I will still tell you. Roughly during pregnancy, if you are in the regular weight range and you have a normal BMI, you can look at gaining about 10 to 12 kgs of weight, and that is considered healthy. If you're overweight, you should try and cap yourself between 8 to 10 kgs, and if you're somebody who's underweight, it could also be anywhere between 12 to 15 kgs. But remember, our weight gain in pregnancy has a lot of aspects to it. You have to take a little bit of your hereditary factor into account. You have to take your metabolism into account. Some people tend to have heavier bones, so you have to take even that aspect into account. The water retention, some people retain a lot of water. It may not necessarily be weight gain on the scale, but it may actually be weight gain due to water retention. So these are some aspects which we must take care of, and therefore don't always look at your weight gain as something which is purely the number that the scale is showing. Okay, my next question is by Supriya. She says, how to deal with body image problems during pregnancy. So, Supriya, I think today's entire talk has been about how to deal with body image issues during pregnancy. And I hope that I have been able to answer your questions and it's going to give you some comfort and you have some quick tips to be able to take care of the same. The other question is it really difficult to get back to shape after delivery? See, this is all dependent on our mental state. It depends on how quickly you get into a fitness program, how quickly you start becoming active. Do you become lax with your eating habits? Because in pregnancy, you've been eating healthy. So, do you think that postpartum now I can, eat whatever I want? I can binge eat. If you're going to adopt that kind of a lifestyle, then it's going to take time. But if you're going to eat healthy, you're going to eat moderate in proportion. If you're a breastfeeding mom, breastfeeding is a great way to help you in going back into your pre-pregnancy body type because it burns a lot of calories when you're breastfeeding. Approximately 350 to 500 calories a day is what you burn when you're breastfeeding. So if you're going to be breastfeeding, if you're going to be active, if you're going to be exercising, chances are that you will be able to go back to your pre-pregnancy body type soon enough. So that's not something that you should be very worried about. Another question that I have is what should be taken in order to avoid stretch marks during and after pregnancy? I think I want to highlight at this point of time, yes, it's very good that you brought up stretch marks because stretch marks are also a topic which are of major concern to women. But please remember, stretch marks are something which can be avoided, but cannot be totally, I would say, eliminated from your body. Stretch marks also have a hereditary angle to them. So if you have somebody hereditarily, maybe your mom or your grandmom, if it's there in your family history, you're more prone to stretch marks. Number two, the best thing to do about stretch marks or to prevent stretch marks is to moisturize as much as possible. Dryness and itching on that dryness is what causes stretch marks. So you must moisturize with a very, very hydrating cream or oil. I recommend that you use vitamin E in that. Vitamin E helps in keeping your skin together in place rather than letting your collagen disintegrate and separate, which is what causes stretch marks. So you can use a vitamin E based oil or a vitamin E based cream. And if you don't have that, if you prefer a specific cream or oil, you can just get simple vitamin E capsules from any chemist shop. Open the capsules, empty about 10 to 15 capsules in the cream or oil of your choice, mix it up and use that. This is something that you have to look at refrigerating and more often than not, you can refrigerate for up to 45 days. So this is a very quick tip that you can do to avoid stretch marks. But the ground rule stays that keep moisturizing, don't let your skin become dry, and try not to be very itchy on dry skin. The next question that I have is, what exercise is safe during pregnancy at home? So walking is very good because it's a cardio. It helps you to stretch all your muscles. It helps with your breathing better. So you must look at walking at least 35 to 40 minutes every day. The other thing that you can look at doing is, if you have a very hygienic swimming pool around, swimming is great because it helps in taking the weight of the baby off your back. You're in an anti-gravity position, so it works fabulously. If you're somebody who can get in touch with a good specialist to help you during your pregnancy with exercises, and it's a trained specialist, I would even recommend you get into an exercise regime with a specialist. They normally do activities like squats, lunges, you'll be learning breathing exercises, pelvic floor exercises, and it proves to be very beneficial not only for your pregnancy journey but even postpartum. So any activity will help you not only in maintaining your weight during pregnancy, but also in the well-being of your body as well as the babies during pregnancy. So this is something you can definitely look at taking up for yourself. All right. Another question that I have is, what causes weakness in the body during pregnancy? See, weakness is something which is a very general term. Today everybody's interpretation of weakness could be different. Is it fatigue that you're calling weakness? Is it actually your inability to be able to carry around your regular chores that you're calling weakness? uh, are your blood reports indicating that there are some parameters that are haywire that are causing weakness? But please remember, in general, hormonally, your energy levels could be slightly lower than your pre-pregnancy state. Also remember, there's a baby that you're nurturing in your womb that also takes exercise. Therefore, it's very important to work on your nutrition. It's very important that you take care of yourself and you move ahead. Okay, let's see if we have any more questions. All right. So all the other questions that have come in for today are centered around weight gain, and I have actually checked and I have covered all those questions that are being asked already in the beginning of our live today. So for any of you who have weight gain related questions, please go back to the beginning of this live. It's going to be there on Baby Chakra's YouTube, and you will get the answer for the question that you have sent me. I am so glad to have been here to share a little bit and give you some quick tips about body image related issues during pregnancy. I hope this has been beneficial for you. You can send me your questions and your doubts that you have through Baby Chakra on my profile that is there on Baby Chakra. And I hope there are some of you who will benefit from this. Until then, that's a goodbye from me, and hopefully we'll be able to meet again.